When I first started, honestly, I was pretty skeptical. I come from a program where, it's a very conservative program. We believe in osteosurgery, regeneration. Those are things I believe in a lot. I'm probably the last person to want to take a tooth out if I don't have to. And when I learned about it, actually coming to the class, that's what I ended up loving about it. I mean, you were talking about keeping teeth a lot of times that you may not be able to keep otherwise. And we're also, it's very pure perio, and I like that, and I like how the class was taught, and I like the information that I was given. One of my patients, Rena, she had a lot of gingival inflammation. She had a lot of bone loss. She was young, 30s, beautiful, and didn't realize that she had so much inflammation, but you could see it when she smiled. At the end of her, I think not even at 6 months, at 3 months after I completed her full mouth, that inflammation was virtually gone. And I think she had no idea how pretty her smile could be without that inflammation until it wasn't there anymore. It's something you might get used to because it happens slowly over time. So just seeing her teeth strengthen up, they weren't as loose as they were before, seeing her gingival tissues healthy, pink, happy looking, that was a big treat. Personally, I feel it works pretty well in cases where patients have a lot of inflammation, and it's also a great option for patients that just will not have surgery, and just like any periodontal therapy, it's not going to work 100% of the time. Osteosurgery does not work 100% of the time. GTR certainly does not work 100% of the time, but it's another option to present to patients. You need to have a lot of tools to work with when you're treating difficult patients, and patients who have periodontitis are difficult patients. There's a systemic connection, there's inflammation you're dealing with, there's a lot of factors that you can't control. So just having another option, I think, is huge.